welcome to the CDO Magazine interview series. I'm Savio Rodrigues with Trianz, and we are partnering with CDO Magazine, MIT CDO IQ, and the International Society of Chief Data Officers in a series of interviews. I have the pleasure of speaking again with Anthony Brockman, Data Director at Fairhaven Community Healthcare. Thanks again for speaking with me, Anthony.
Thanks for having me, Savio. I appreciate it.
We have been discussing what makes a great modern data and analytics platform. Now, I would like to discuss how does one deliver value through enterprise data and analytics. The failure rate for analytics, AI, and big data projects is around 85%. What would you say is the reason or reasons for why we are seeing such a high failure rate?
So, Savio, it's a great question. I think with analytics, with technology implementations, you do see a lot of failure, a lot of lack of arriving at a place where you feel there's value being given for so much money and time spent on an implementation. I think a lot of this comes back to understanding organizational culture and leadership. And I say leadership because you really need more than one person to implement these technologies. And I know many times an organization will hire a chief data officer, a chief data analytics officer, a CTO, a CIO, the various technical people who are within leadership, and ask them to implement. And if you're in a place where your organizational culture really doesn't support that, you're going to have a problem if you don't have additional leaders helping, right? So you can have the CEO and you can have the board, and they're pushing for this change, but where the rubber hits the road is at the departmental level, right? So the places that are actually going to use this technology, that's where you need some leadership. That's where you need everybody going in the same direction. That is where you need the most change management, right? And this really is an exercise in change management when you talk about implementing technology into whatever environment, whether it's a clinical environment, whether it's a finance environment, whatever the environment is, you really need leadership across the board.
Thank you for sharing that. And so if I may pick on the topic of change management, it has its own cycle and process. So as data and analytics leaders, how do we break this and reassure the value of these new technologies?
I think with clarity, right? So again, if we're the point person for this implementation, we have to have clarity around the people, around the process, and around the technology. And we really want to answer for those other leaders who are going to trickle this down and stay on the same message. We want to be able to answer for them the what, when, and how. The what's in it for me. Why am I making this change? This is actually going to be more work for me in the short term. We need to be able to articulate to them again that what, why, when, and how to get them on board with us, to get them moving in the same direction. That is how we go about with better outcomes for implementations. Again, as I said, it's an exercise in change management, right? And you may have to push that message multiple times to the same person, but that is what our job is, right? To lead this implementation. We can't expect that we're going to tell a leader one time this is why we're doing it and walk away and it's going to happen. It's not. We have to be that cheerleader. We have to make sure that people are on board and they're going to stay on board. And we have to demonstrate whenever we can why we're doing this.
Yeah, I totally and completely agree. Being the cheerleader and demonstrating it, on a constant basis is so important. And I always like to hear how others stay current. And I'm sure the listeners also to this discussion today would love to hear how you stay current with the latest innovations and offerings. What excites you about the future of data and analytics, and what types of innovations are catching your eye?
Definitely. So one way is CDO Magazine, right? I subscribe to CDO Magazine. I look at the many videos out there. I read many articles about what people are going through. I think you really get a flavor for what's going on in the industry. You see a lot of, oh yeah, that's happening to me too. But then you also see some success stories or some failure stories out there that you can take as a warning from people who are also in the industry and across who are also in the analytics industry, but across different industries, right? And so that has been important. You really have to keep up with kind of literature. You have to go on these vendor pages and see what they're doing and follow them over time. And I think that will inform you about a lot of what is going on. And there are also, a lot of educational opportunities out there now that weren't there 20 years ago, where you can go out and get a graduate certificate from a university that is being taught by current CIOs, current CDOs, current CTOs, or current people in the information security industry. And so I think that's important to do, because you can easily fall behind in understanding what's going on, and what these new technologies are actually doing and what they can offer you. What gets me excited, the technology is always exciting, but I'm more of, I look at the process, and I think data literacy, the talk around data literacy in the past couple of years has actually got me excited, because from working with data and working on the technical side, that stuff is complex. And if you build something and nobody understands it, or it doesn't bring them any insight to what they're doing, what good is it? It's none, right? So people are talking about data literacy now and governance, and really putting in the spotlight that the people who are consuming this information, who are consuming this data and using these technologies, they have to have some ability to truly understand what it is they're looking at, and understand why they're looking at it and what it will do for them in their day-to-day work. So I think that talk of data literacy and the pushing of data literacy now, I think that's very important. Data governance has always been important, and they've been talking about that for a long time, but we have to stay on topic with that also. And then these new tools, the tools we just talked about, modern advanced analytics platforms, I think the ease of use, the more human-centered design that we see with these products, that's exciting to me, because now you don't need somebody. I started out in computer science. I was doing Pascal and C+, and and doing and SQL and using these languages. And who on the business side is going to use those languages, right? Who is going to go in? What financial financial person, what accountant is going to go into R to do a statistical analysis? It's just, that's not what their job is, right? No surgeon's going to go into R to help their job. So building these systems that allow for ease of use, whether we're going to push the information and only the information, or whether we're going to give somebody access to actually use these systems and to explore, do some visual analytics and explore the data themselves and come to some insightful conclusions. The ease of use that we're seeing now is exciting to me.
No, totally. I cannot imagine. It's so important. I've been interacting and engaging, and data literacy, ease of use, and self-service, and enabling so much of that, to go forward. So thank you for sharing that perspectives. Like to also get your inputs on what would you tell others who are interested in leading data-driven approaches in the health sciences?
Definitely, don't underestimate the amount of non-technical work that needs to happen. And by that, I mean, right, the process and the people, right? You have to really start with governance. You have to push governance. You have to make those connections with people to kind of get everyone going in the same direction. Data-driven is hard. It's the buzzword, right? Everybody wants to be data-driven. Look at Google, look at Charles Schwab, look at these organizations that do all these amazing things and make money and things like that. Everybody wants to be data-driven. It's extremely hard to be data-driven. You need a bunch of people going in the same direction to be data-driven and use technology and data to inform the work that they do and to get new, brand new insights, things they never thought about. And so I'd say start with governance, start with use cases. What's your use case? Don't just implement something simply because somebody else in another company said we use it and it's great. What's your actual use case at your organization to implement some technology, some analytics technology, or some business intelligence technology? And then again, the people process piece, you just can't underestimate that. You really have to bring a lot of people into the fold, whether it's incremental change or it's big bang. You have to bring a lot of people into the fold so that there has to be a lot of clarity around what you're doing and answering the why we're doing this. What does this mean for the organization? Implementing technology, I'm getting paid to do that, but what's it doing for the actual organization? How is it helping the organization? And in our instance, how is it helping patient care? How is it helping ease the burden for our clinicians?
Totally. In this case, how the business is the patient care. So how is it helping the business, the end thing? So absolutely. Well said, Anthony. I know we are almost out of time, but I did want to end on the unexpected benefits of data. So would you mind sharing any scenario where data is being used to benefit the healthcare industry in a way that our listeners might not expect?
That's a great question. I think maybe a social determinants of health. The average person, I think, doesn't quite realize that when we are looking at, are they in a food desert? What type of access do they have to food? What type of access do they have to an atmosphere or an environment where there's no violence, or an environment where they can thrive? What type of access to parks, things like that, do they have? I think when the average person might not realize that those things, the way healthcare is going, the way we look at healthcare now is less so the acute care, being in a hospital because, hey, I have, my heart's bothering me, I have headaches all day long. But more so looking at the total environment, of care, and understanding, especially in underserved communities, understanding that a person's environment has much more impact on their health than anything else, right? The economics, where you live, access to food, safety, right? Access to safety, or a safe environment, living in a safe environment. Those things have much more impact on your health than anything else. And so I think people don't realize that looking at those social determinants, looking at that data and how people are using that to bring in community-based programs to assist people with these issues that they have that are outside of the hospital walls. I think a lot of people don't realize how that data is actually impacting healthcare, and how, going forward in the future when we talk about population health, how we hope to keep refining use of that data to help people, and help them in their day-to-day lives, because that's really what's impacting their health.
Oh, very interesting, and it was very insightful to learn, in that context. Well, that's about all the time we have. I would like to thank my guest, Anthony Brockman, Data Director at Fairhaven Community Healthcare. Thank you so much, Anthony, for your time.
Thank you for having me, Savio. I appreciate it.